Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Permanent Secretary of the Ministry of Health, Letitia Lestrade-Wyke, the Director of Primary Healthcare, Dr. Laura Esprit, National Epidemiologist, Dr. Shaluddin Ahmed, the Deputy Chief of Police, Lincoln Corbett, our media colleagues, to the listening and viewing public, good evening. Thank you for joining us again for another update on the COVID-19 situation in Dominica. Let's get things started right away, and we'll begin with a presentation by Dr. Ahmed.
Thank you, Ms. Harry. Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, Permanent Secretary of Health, Wellness and New Health Investment, Dr. Laura Esprit, Director of Primary Healthcare, Mr. Lincoln Corbett, Deputy Chief of Police. Pleasant evening to everyone. The total confirmed cases of COVID-19 remain at 16. 13 have recovered. The remaining 3 cases are having their tests conducted as part of the discharge procedures, and we await their results. Contact tracing has been halted for the moment as all contacts have been cleared. As of today, a total of 401 individuals have been tested for COVID-19 using PCR method. Of these, 385 were negative, and there have been no deaths due to COVID-19. Today, I want to speak briefly on possible COVID-19 pandemic outcomes. Based on new research, we know that its R0 and incubation period is higher than our seasonal flu, meaning it spreads to more people, and it spreads faster. But what we do not know is how long we will be in this outbreak situation and how long it will take us to develop the highly coveted herd immunity. I know this may seem bleak, but if we continue our current control measures and develop a robust community testing program, we may be able to halt the virus in its track. We need to avoid an outbreak during the hurricane season or a slow burn with continuous transmission of the virus with no clear pattern. As mentioned before, community testing, once implemented, will prove to be beneficial to formulate our exit strategy. Currently, the Ministry of Health has commenced the testing of high-risk healthcare workers as part of our active surveillance plan. And as part of this plan, we want to extend this testing to all frontline workers, permitting the availability of the resources. Dominican citizens have adopted social distancing, good hand hygiene, and proper respiratory etiquettes as part of the new normal for them. And this has proven successful so far, and it is working. But we need to be wary of a possible second wave. The fight is far from over. We must continue to engage these life-saving behaviors. The COVID-19 pandemic is showing us that it is not about survival of the fittest, but survival of the smartest. That is to say, countries who ranked high in the preparedness and healthcare index have now been brought to their knees by this invisible pathogen. We do not want to become like them. So we need to play it safe and play it smart. Therefore, continuing to stay home, wearing masks when you're out, and practicing good hygiene is essential in order for us to be able to begin the process of opening the country and moving past this pandemic. With this, I thank you.
Thank you, Dr. Ahmed. And as always, we're very grateful that you're on our side. You're on our team and working with us and working so hard. As you heard, the numbers in Dominica remain the same. And you would have heard Dr. Ahmed speak about community testing. I'd like to encourage the general public to exercise a little bit of patience as the logistics are finalized for the community testing. We know a lot of people would like to know, when can I get tested? But of course, this is not just a snap your fingers and go type of initiative. There are things that need to be put in place. So again, we ask for your patience. Our next presenter is the Director of Primary Healthcare Services, also with the responsibility for contact tracing, Dr. Laura Esprit.
Good evening, all. My name is Laura. I live in the community of Dalis, and I am one of the 16 persons confirmed with COVID-19. Let me invite you to listen to my life-changing story, which I call The Silent Cries of Number 16. I am 48 years old, born and bred in Dominica. I enjoyed farming and own a small grocery shop to the front of my 2-bedroom house. I pay my taxes and I provide for my family as best as I can. Unfortunately, a few weeks ago, I received an unexpected call from a Dr. Esprit from the Ministry of Health, informing me that I was a potential contact for someone diagnosed with COVID-19. I was in pure disbelief. Why? I had no recent travel history. My last trip was actually to St. Martin in about 1995. I had no interactions with anyone I knew to be COVID positive. I was never ill, and of all the people in Dominica, why would COVID-19, a new virus, why would it choose me? Nonetheless, I agreed for testing. I was informed that results would be in after 48 to 72 hours. Truth be told, this 59.5 hours were the longest hours of my life. I never slept. I couldn't sleep. I couldn't eat. I didn't have the will to care for my kids, neither myself. For the first time, I neglected preparing meals for my children. The thoughts of dying, not having fulfilled my dreams, it actually haunted me. Not seeing the rest of my family again, not seeing my children grow. I knew of the majority of cases being mild, but the images I had seen on WhatsApp and on the news, they were just flashing in my mind, of persons on ventilators and persons fighting to breathe. Breathing, a gift we take so casually. And because of that, I certainly wasn't prepared for COVID. Not now, not ever. I thought if I was positive, I would have to go to an isolated hospital in Portsmouth among sick people. I also thought when the ambulance comes with the sirens, everyone in the neighborhood would know for sure that I have it. What would people think of me? And so every day, 3 to 4 times a day, I would call the doctor, asking, begging for an update as it relates to my results. The response of, "It's not yet ready." This just threw me into a hysterical spell, confirming my greatest fear. I assumed it was taking longer because the test was likely positive. At this point, my anxiety was at its peak. Finally, the call came. The doctor's exact words were, "I'm sorry to tell you, but you are positive for COVID-19. At first, I was in total denial. I asked Dr. Esprit, "Are you sure?" "But doc, I am not sick." "What do you mean I have COVID-19? Could there be an error in the testing? Maybe, a false positive, maybe?" Imagine that. Of the 71,000 persons on island, who would think that I would be among the 0.02% of the population diagnosed with COVID? Upon giving instructions that I should prepare to be transferred to Portsmouth COVID unit, I asked, can't I stay home and take my treatment there? Or can't I at least drive to Portsmouth instead of having the ambulance collect me at home? Doc, my family, they're all adamant that I shouldn't leave because I'm not sick. Finally, the ambulance came, packed alongside my house with the siren lights flashing. By then, the 2 ambulance drivers, 1 doctor and 2 nurses were on my front porch, dressed in a suit I had never really seen before. I mean, they had long sleeve, helmet, goggles, eye shield, gloves, mask, you name it, as if they were going to space. And guess what? Even if I understand why now, I must tell you, it made me feel dirty, contagious, infectious, less of a human. Assuming that this was the worst feeling ever, I felt like I was under a microscope, with prying eyes of neighbors and passerbys, especially those with their cell phones aimed at me, taking videos as if I was an exhibition. With much courage, I made it inside of the ambulance, grieved, heart racing, not sure what to expect, in tears, waving my family goodbye. Would I ever return home? One thing was certain, life would not be the same after this. My last image was of my kids crying outside. My spouse, completely lost for words. And as for me, I sank into a depression, one that I didn't know existed. I felt embarrassed, shameful, vulnerable, as if I had committed a terrible, unforgivable crime. 6 weeks came and went at the unit. It felt like forever. Persons who came after me had returned home, and I was left to think, is there something wrong with me? I was in a room by myself with interactions limited by quick checks by the health team. Despite sensing their warm disposition, still, there remained a barrier of no physical skin contact, no visible smiles, and worst, no family visits during one of the most critical phases of my life. The loneliness, sadness, emptiness, the silent screams were overwhelming. That was truly mental torture. Truth be told, I wish I could have traded places with you, the public. I would have given anything to be in your position, on quarantine or weekend lockdown at home, in my own environment, and in the care of my loved ones. Shortly after, I actually grew angry, thinking that if only the previous contact had heeded the warnings to stay home, then I would not have contracted the disease from them. I spent most nights awake in bed, pensive, mostly due to my fears of returning home. These fears intensified after hearing the terrifying experiences of my new friends who were already discharged. After all, we were the 0.02% on the island, and we were able to identify with each other's hardships. Finally, my result came back negative for COVID-19. It was one of the happiest days of my life, but nothing could have prepared me for what laid ahead. As promised, I followed all the guidelines provided by the health team, including the 14 additional days of home quarantine, and I ensured that my family had taken the necessary measures as well. Today is day 20 since I have been home, and I must admit that it's as terrifying as the day when I found out I was positive. What do I mean? I have been mocked. People would say, look, number 16 coming. St. James Matron come back. Ma Wuhan viwe. Mi Jean Corona la. I felt guilty when remarks are made that it's because of me the country remains on lockdown, and I am the reason why persons have to use masks all the time. Despite being cleared by doctors and being in good health, I must tell you I feel scared, fearful for my life by the way in which people gaze at me. No one comes to buy from my shop anymore, neither do they buy my provisions. What will happen to me, to my family, if I can't provide for them, if I don't have money to pay the bills or send my children to school? My neighbors have avoided me, and even some of my church members hardly say hello. Yet I have seen a few join with the whispers. Some say, I need more prayers right now. When I go to the supermarket, I become more embarrassed and unsure whether to place the money on the counter or into the cashier's hand, things I never thought of before. Going to Roseau may be in the far future for me, as the bus drivers no longer stop for me. When the phone rings, usually the familiar voice on the other end limits the conversation to a simple, "How are you?" not knowing what next to say, as if fearful they may catch COVID over the telephone. It breaks my heart that now the children in the community have started bullying my kids, and it's all because of me. And my spouse, sadly, I think I lost him too. He no longer looks at me like before. He refuses to touch me. And his words are usually limited to good mornings, as he uses any excuse to get out of the house. A negative result for any disease should be a sigh of relief. But the reality is, my reality, is that my nightmare really began the moment I got the results, and when my community figured the true identity behind patient number 16. Yet the 6 weeks at the unit was nothing compared to this brutal judgment of the public. I can't help but think, would the public have been empathetic, maybe if I was a healthcare provider who contracted the same disease in the line of duty? Nonetheless, this is something I did not choose to inflict on myself. I didn't want this disease at all. Sometimes I feel that I should maybe put a sign around my neck for all to see, saying COVID negative. And other times, with mixed feelings, I momentarily console myself in that I know my status and I've lived to tell my story, whilst there may be others who do not know their status and are not as fortunate. Sadly, I remain at the public's mercy. However, I see a long, long road ahead of me. Hopefully, one day soon, if your sense of compassion permits, I'll regain a semblance of normalcy, of the livelihood I once had at my home and in my community, when I will no longer be known as patient number 16. In the interim, I will remain indoors as long as I possibly can, where I feel safe, and most importantly, where I can salvage what's left of my dignity. To the Honorable Minister for the Ministry of Health, the Permanent Secretary for the Ministry of Health, Deputy Chief of Police, our National Epidemiologist, the media, the listening public, good evening. This silent yet genuine cry of our COVID negative clients, it begs us to stop and rethink. This is what is referred to as stigmatization. This prejudicial behavior is an adverse or hostile attitude towards a group of people or an individual, and is characterized by irrational stereotype beliefs and can lead to the following: feelings of depression, shame, and embarrassment, diminished self-worth, engagement in substance misuse and abuse as a coping mechanism, lack of understanding and support by family and friends, employers' reluctance for engagement, social isolation, and suicidal inclinations due to social ostracization. Whilst everyone is pleased to hear the confirmed COVID figures are not beyond 16, the numbers of recoveries is increasing, we also have a responsibility to avoid stigmatization and provide the necessary reassurance and support to all who have recovered thus far. The public's reaction can either hinder or advance the client's complete recovery, which includes both their physical and mental well-being. And this can impact their reintegration post-COVID. Laura's story could become our personal story, as we are all vulnerable to COVID and would want to have the golden rule apply to us, one of treating others as we would want to be treated. The Ministry of Health appeals to the public that clear guidelines are followed for all clients prior to discharge. And this includes having 2 negative COVID results at a minimum of 24 hours apart, followed by a strict 14-day home quarantine cycle under the supervision of the health team. This is in an effort to ensure that the client is medically cleared and can return to their normal lives. The Ministry of Health reaffirms that the standards for COVID protocols for the discharge of clients are internationally upheld, and therefore there is no reason to doubt the application of said protocols post-discharge. Please be reminded that we should not only focus on the decreasing figures of active cases on island, but also take the opportunity to welcome our recoveries back into their home communities. In conclusion, let me remind you that the 2020 hurricane season is exactly 1 month away. COVID will not disappear on the account of the upcoming season. And as a result, this COVID season is one to be taken seriously, as we are confronted with not one, but 2 phenomena: infectious nature and natural disaster. So let's bear this in mind as we continue with the dual preparations to protect the lives of our families and our citizens. Thank you. Good evening.
And thank you so much, Dr. Laura Esprit, the Director of Primary Healthcare Services, for a very moving presentation. And like Dr. Esprit says, there are several Lauras on island, and we all have a role to play in helping them recover, not just physically, but emotionally and psychologically. So again, thank you, Dr. Esprit, for that insight that we may all have overlooked as we pay attention to numbers and forget that these numbers represent people. Our next presenter this evening is the Deputy Chief of Police, Lincoln Corbett.
The Honorable Minister for Health, Wellness and New Health Investment, Dr. McIntyre, National Epidemiologist, Dr. Hamid, Director, Primary Healthcare Services, Dr. Esprit, PS in the Ministry of Health, Ms. Wyke, the listening public, good evening. I'm grateful for yet another opportunity to address you on the police continued operations and plans in policing SRO number 15 in a pursuit to get rid of COVID-19. The police force continuously reviews its operational plans to ensure compliance with the advices issued by the Ministry of Health to combat this disease. From the onset, we understood clearly that the police had a pivotal role and we have endeavored to do so with the ambit of the law. From our report, it appears that we have been very successful in our efforts of containing this disease, and citizens have been rewarded for adherence to the measures imposed. It's our wish that the state will soon return to pre-COVID-19 days. However, in the meantime, some measures are still necessary to eradicate this disease. These measures, as I indicated before, are not meant to be punitive, but in the best interest of everyone at this time. On Saturday, April 25th, 2020, the Honorable Minister advised on government decision to ease restrictions contained in SRO number 15 of 2020. The easing of restrictions on some of these measures would allow citizens and businesses more latitude to function. It is not intended to give the impression that COVID-19 is no longer a threat. We are not out of the woods, and we are reminded daily that our neighbors are still recording active cases of the virus. We therefore must not drop our guard and become complacent. I must inform that we have intensified our patrols both on land and sea, and will continue to maintain our various checkpoints. In this brief, I will focus on 4 areas. That is restrictions to travel, public transportation, liquor license, more specifically, the sale and consumption of alcohol, and the weekend curfew. Restrictions to travel. This measure remains in place, and all our ports remain closed. No visitors are allowed without the express permission of the Honorable Minister. In previous briefs, I warned boat owners and boat captains, as well as our citizens, to desist on entering or leaving the state through ports that are not designated as such. I also indicated that this practice poses a major threat to the security of the state and could undermine all the efforts of the Ministry of Health. I again warn these lawbreakers to cease and desist from this illegal, selfish activity. A public service vehicle will now be allowed to carry 2 passengers per row, provided that the passengers wear face masks. Additionally, the drivers are expected to ensure that the hands of the passengers are disinfected. Ultimately, however, it is the responsibility of the passengers to protect themselves from the disease. Drivers of public service vehicles who breach the order risk being fined. And additionally, police officers have been instructed to remove people from these vehicles who refuse or fail to adhere to the measures. It means, therefore, you may find yourself stranded in a remote area, and the bus driver also faces the possibility of losing income. So just comply to the simple measures and avoid the embarrassment. With reference to liquor license, as of Monday, April 27th, at 8 a.m., residents were allowed to sell and consume alcohol beverages. This, however, has conditions attached. Bars are to remain closed, and there shall be no consumption whatsoever of alcoholic beverages at the place of purchase. You are therefore strongly advised to avoid any inconvenience, including the possibility of prosecution, and adhere to the conditions as stipulated in the SRO. With reference to the curfew, there have been no changes to the curfew hours, and so the curfew period remains in effect until May 11, 2020. Generally, Monday to Friday during daylight hours, residents are allowed to be in a public place only to access or provide an essential service. Also, you are not permitted to be in a public place between the hours of 6 p.m. and 6 a.m. Monday to Friday. So if you have no legitimate reasons, as stipulated in the SRO, to be out, you are to remain indoors. This weekend, as all other weekends, will again be on a total lockdown. That is, from 6 p.m. this evening, Friday, May 1st, until 6 a.m. on Tuesday, May 5th. Monday, May 4th, 2020 is a public holiday. Usually, large members of our populace gather for picnics at rivers and beaches. However, these are not normal times, and I again appeal to you to remain indoors. It has been brought to our attention that certain essential workers and people exempted by the Chief of Police are not adhering to the order. This privilege, I'll reiterate, is not unfettered. As an essential worker or the holder of a curfew pass, you will only be allowed to be outdoors to perform your duties. Once you have completed your duties, you are required to be at home. I must remind you that the permission granted is for the specified purpose and nothing else. I wish also at this time to take the opportunity to thank all the frontline workers and essential business providers. A special thanks to my fellow officers, those of you who have heeded the call and are determined to fight the spread, to try to prevent the spread of COVID-19. Your efforts and sacrifice have been noticed and are truly appreciated. We want also to thank the many people who continue to stand with us, whether through prayers, granting of priority access to services, financial and other contributions, as well as providing hot meals. I pledge our continued commitment in this fight, and we will do our very best, as far as is reasonably practicable, to continue to police the order and ensure strict compliance by all. Stay safe, stay indoors, stay COVID-free. Thank you.
Our thanks to the Deputy Chief of Police, Lincoln Corbett. Again, to reiterate, lockdown weekend is upon us. Monday is a national holiday. That means that Monday is included in the lockdown. As far as curfews are concerned for next week, nothing has changed. From 6 p.m. to 6 a.m., you are to remain indoors during the week. I want to thank Mr. Corbett and the other police officers on island for all of the work, all of the hours that they have been putting in. And I ask for your continued cooperation with the police. If you are stopped at checkpoints, please cooperate. They are doing this for all of our safety, not because they want to be patrolling on the highways for hours on end. So thank you again, Mr. Corbett. And finally, this evening, we welcome to present the Minister for Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre.
Good evening. Let me recognize our national epidemiologist, Dr. Shaudin Ahmed. Let me recognize Dr. Laura Esprit, our Director of Primary Healthcare. And I also recognize Deputy Chief of Police, Mr. Lincoln Corbett. We're here again for yet another COVID-19 briefing. And as usual, always a pleasure to disseminate the information and by doing so enlighten the public as well. You've heard from the previous presenters as regards to our present status, our ongoing activities, and our public health and social measures, that is, our restrictions, so to speak. On Monday, it will be 4 weeks since we've had our last positive case. We obviously feel a sense of relief, But this cannot be seen as a time to relax and be complacent. If anything, this is a time to appreciate the fact that we're in this relatively calm period of no transmission due to our proactive actions and actions over the past months. This is a time to continue what we've been doing. Most of you have done well and been part of the COVID-19 fight. But we must stay focused if we are to continue doing well. This is a time to turn this challenge into an opportunity as regards to spending time at home, building the family. That's the basic unit of our society. This is also an opportunity to prioritize as regards to what we spend on, how we spend on. This is a time when income has been decreased, whether we are out of jobs, whether there are limited working hours. So this is a time to economize and to prioritize. It's also another opportunity as regards to backyard gardening, eating what we grow. So let's make use of this weekend. Let's do something in the yard. We also have opportunities as regards to preventing future infections, because some of the measures that we're doing here in terms of hand washing, respiratory etiquette, sanitizing and disinfecting our homes and workplaces must continue even after COVID. So it's also an opportunity to get all these as a habit. There's also the human aspect, because in our communities, there might be elderly who can't get out, and we, those who can, should assist in getting them the things that they need. This is also a time and an opportunity to be pragmatic and to be innovative, as we've seen with our local mask production. Lots of different colors, well done, and they do just as good a job as the other surgical masks. Going forward, life after COVID will never be the same. There are basically three outcomes that are possible. There is the complete interruption of human-to-human transmission. There can also be the epidemic waves, which could be large or small, and there can be actually a low-level transmission. So these are the three possible outcomes. Obviously, we'd love to have the complete interruption of human-to-human transmission, but these are the three options, and let's see how it goes from there. The Ministry of Health remains committed to containing the transmission, maintaining zero mortality, and achieving no or low-level transmission. That is why even we've completed our contact tracing, we're still moving ahead with case identification, and so we keep testing our frontline workers and the more vulnerable people as well. And besides the testing that goes on, we have also completed our second COVID facility in Portsmouth. We have also completed our port health facility at the Douglas Charles Airport. And these are hurricane-proof structures. So that means we're actually building capacity for the future. Environmental health and quarantine activities measures remain in place and are ongoing. This is all because we don't want to sacrifice the gains that we've made, and we want to remain in a state of preparedness. Our technical staff is due to meet again this week coming. On Tuesday we shall meet, where we will assess the situation and make further recommendations. That's how the Ministry of Health has done it from the beginning. We work with a plan. When making such decisions and recommendations, there are a few things we must consider. So we consider the scientific evidence available. We consider the different international experiences because we learn from our neighbors. We also consider the socioeconomic impacts, the human rights, because we're putting restrictions on people, and we also assess the food security as well. The tightening up or loosening up of as regards to public health and social measures really is based on risk assessment. That's where we balance the risks posed by relaxing measures that have been put in place. And then we also have to take into account the level of transmission when we make such decisions, our healthcare capacity to cope with a resurgence of cases, our ability to reintroduce or tighten the public health and social measures, particularly for the vulnerable settings, which might be hospitals, schools, business places, fresh marketplaces. The community engagement through education and health promotion. So all of these are considered whenever we decide how and when we're going to relax or tighten the measures. We must acknowledge the fact that COVID-19 is a learning experience for the entire world, Dominica being no exception. Considering our geographical location, our increasing tourism industry, we have to consider the fact that the Caribbean is the most sought vacation area in the world, and there will always be introduction of new diseases by the visitor population. We have seen it with SARS, we've seen it with H1N1, we've seen it with chikungunya, we've seen it with Zika, and now we're seeing it with COVID-19. And we should not be naive, because there will be more. So that is where preparedness and planning from the Ministry of Health is of paramount importance. The Ministry of Health will continue to build its national surveillance system that can capture illnesses as early as possible and make it an integral part of our public health obligations. We have learned very well how time is of the essence, not just in dealing with infections, but in terms of our preparedness as well. The importance of the multi-sectoral approach cannot be overemphasized. The participation of all stakeholders, from immigration to environmental health, to diaspora, to customs, to fire and ambulance, quarantine teams, doctors and nurses, support staff of the COVID facility, primary health care and its district teams, the labs, the health promotion, the volunteers, everyone has to be part of it to have the success that we really want to have. And for your involvement, the Ministry of Health and the Government of Dominica, by extension, will forever be grateful. We make special reference to PAHO for the support they have been extending to Dominica. Even before COVID-19, and now more than ever, their effort is really appreciated. As regards to the supplies, as a matter of fact, just on Monday, we got more supplies from PAHO, that is 395 PPE kits. This includes headgear, your masks, goggles, gowns, and boots. And that's besides the test kits that we receive from PAHO, our PCR test kits, lots of other PPEs, lots of masks, gloves, etc. They also assist us with health promotion material, technical support regarding training, sharing of information, updates, teleconferences. And presently, they're also helping us with a proposal to do community serological testing, which will give us an idea of our immune status as regards to COVID-19. This will begin most probably later next week, since we've been waiting for a 4-week period. And within this 4-week period, obviously, we'll get a better result regarding the immune status as regards to antibody production. We will also be appreciative of our international friends. That is the People's Republic of China, the Republic of Cuba, the Bolivarian Republic of Venezuela as well. Our frontline workers, we will keep mentioning you because you make it work. The country is not only proud of you, but extends its deepest gratitude as well. So in closing, I would like to urge us to make use of the lockdown. Let's be creative, let's be productive, and let's continue to work hard. Let's not let down our guard. We continue our hand washing, our proper wearing and removal of masks, sanitizing and disinfecting our homes, workplaces, business places, physical distancing, reporting suspected backdoor entrance. This is very important for us since we need to know all persons coming from abroad, and our borders are closed, so anyone suspicious in your community, please report to the health team or the police as well. I wish everyone a pleasant May Day weekend, and I thank you, and may God bless Dominica.
Thank you so much, Dr. McIntyre, the Honorable Minister for Health, Wellness and New Health Investment. And before I say good night, I want to address our friends in the diaspora. And I know it may feel like you've been neglected. You are Dominicans as well. And what I'd like to tell you is as we continue to rejoice in our numbers here, we continue to keep you in our thoughts and in our prayers, because we know that where you are, it is very difficult. And we know that even if we cannot be with you, we are here for you. With the advent of technology, we are only a phone call or WhatsApp video call or FaceTime away. So don't hesitate to contact us back home. So again, those of you who always tune in from the diaspora, we wish you well as you battle COVID-19 wherever you are. Ladies and gentlemen, as always, we thank you for your attention and we ask you to stay safe this weekend, stay in this holiday weekend. Good evening.